Preparing for the final journey. Advanced care planning is a way for patients and their families to arrange for the right type of care at the end of life. Rod Starnes explains how families can find ways to deal with that often difficult topic.
For Janet Nix, retirement means reading, travel, and the freedom of doing what she likes. But a series of health problems for her and her husband got them thinking more about what could happen in case of a catastrophic illness. So they decided to prepare advanced care plans.
We've always wanted to do it because it only makes sense that you would plan for that when you still have some sense and can have things happen the way you want them to.
An advanced care plan contains specific instructions that let family, friends, and medical providers know what health care decisions you would make for yourself. Janet Nix and her husband got advice from Baptist Trinity Hospice to set up plans.
So an advanced care plan allows you to plan for healthcare decisions at a point when you may not be able to make those decisions.
According to Ashley, Tennessee law changed in 2004. What used to be known as a living will is now an advanced care plan. Simply put, it's a document that tells your doctor how you want to be treated if you're terminally ill or permanently unconscious.
Every person's values are different. Every person, what they want for their health care is going to be different. So having thought through that and having discussed that with someone who can be your advocate is important to know that on the front end. The advanced care plan only comes into effect when the patient or person is not able to make their own decisions.
That means people can let doctors know they don't want interventions that would prolong life, including CPR or breathing machines. As part of the plan, people can also appoint a healthcare agent, a person to make decisions for them, what used to be called medical power of attorney.
We all know people who have had the situation in which somebody has just gone on and on and on. You always talk about quality of life, and different people have different ideas about what that might do. But for me, not being able to see or hear would really compromise my quality of life.
A recent study in the Journal of the American Medical Association found that the use of advanced directives that limit end-of-life treatment in certain parts of the country are associated with lower Medicare spending, reduced likelihood of dying in a hospital, and increased use of hospice care. For Nix, knowing she and her husband will get the care they want makes it that much easier to enjoy retirement.
As I've said before, a lot of times I'll just say, I'm doing nothing today and I can do the same thing tomorrow and the day after. It's just a wonderful situation.
You can find out more by calling Baptist Trinity Hospice at 901-767-6767 or by logging on to the website on your screen. For Smart Medicine, I'm Rod Starnes.